Bismillah ar-Rahman ar-Rahim. Our subject today is lupus erythematosus. In general, lupus erythematosus is an autoimmune disease in which the defense cells of the body attack the organs of the body and connective tissue. There are three subtypes of lupus erythematosus, which are systemic, discoid, and subacute. Systemic lupus erythematosus is an autoimmune disease. In this disease, the immune system of the body mistakenly attacks healthy tissue. It can affect the skin, joints, kidneys, brain, and other organs, causing widespread inflammation and tissue damage in the affected organs. While discoid lupus erythematosus is the most common chronic form of cutaneous lupus. The most important thing that we must focus on is cutaneous, because this type has no any systemic manifestation. It is only affect the skin, so confined to the skin, and is not associated with symptoms from other organs. It is less aggressive and rarely progressing to the systemic form. طبعا it is less aggressive from the systemic form, okay, and rarely progressing to the systemic form. It has a cosmetic effect because it primarily affects the face and affect its aesthetic. So the third type is subacute lupus erythematosus. Subacute, lying intermediate between the systemic and the discoid in its symptoms and its aggressiveness. So it is a non-scarring, non-atrophy producing photosensitive dermatosis. التهاب بالسكن يصير photosensitive skin. So subacute lupus erythematosus commonly develops in sun-exposed areas. The most thing that subacute distinguish in its type from other types is يحدث بالsun exposed area, including the upper back, shoulders, extensor arms, and neck. Etiology of lupus erythematosus. The etiology, as any autoimmune disease, is unknown because the body attack itself. So, but there are many etiologic probable factors and risk factors that can probably cause this disease. Most probable causes is genetic influence. This is the main cause genetically. Hormones, and especially in female. Environmental factors such as sunlight exposure may bring on lupus skin lesions. Infections, having an infection can initiate lupus or cause a relapse in some people, مثل infection بالإنشتاين بار فيروس, psychomegalovirus, varicella zoster virus, may increase the risk for developing this type of disease. For certain medications, some drugs can also predispose the patient to develop this type of autoimmune disease, such as antihypertensive patient مثل hydrolyzine, methyl dopa, antibiotic, and antipsychotic اللي هو chlorpromazine يستخدم for seizure patients, يستخدم كأنتي seizure. This is the probably most factors that may cause lupus erythematosus. Now we will talk about discoid lupus erythematosus. which is the cutaneous form of lupus erythematosus. It is a chronic and localized skin lesions involving the bridge of the nose and adjacent cheeks. It is present with red, inflamed, cone-shaped patches of skin with a scaling and crusty appearance, most often on the scalp, cheeks, and ears. طبعا الديسكويد هو confined with the skin only. Discoid lupus erythematosus يعني has a distinctive features اللي هي تكون يعني ليجن تشبه الكوين اللي هي شو اسمه العمل المعدنية خصوصا بالفيس تصير مثل هاي الصورة مبين هنا وكذلك يصير شلون الإحمرار الريدنس والكراستينج اوف سكين يعني كأنما يعني تقرح أو تقشر بالسكين especially on the cheeks and the bridge of the nose. So give it the appearance of butterfly الفراشة without any systemic manifestation, and this is the most important thing that discoid lupus erythematosus distinguished from other type. Rarely discoid form may develop into disseminated form. من النادر انه يعني ممكن انه يعني يتطور ويصير systemic form. Skin lesions occur on the face. It involves malar region and cross the bridge of the nose, which gives a butterfly distribution مثل ما قلنا. هنا الصور توضح هذا الشيء. هنا أنا اليمين coin like lesion. هنا مبين البutterfly appearance. هنا الليجن اللي صاير بالسكالب. May also cause hair loss. While systemic lupus erythematosus, lupus erythematosus can affect multi-organs of the body. The skin will appear as a photosensitive skin, butterfly appearance, the area that exposed to sunlight مثل الarms, legs, الback. So erythematous rush to the area exposed to sunlight. Kidney effect causes kidney inflammation and inflammation of the urinary system. The heart will be affected also. Tachypnea, cough, pleural inflammation. The heart and the lungs, and other general symptoms such as weight loss, fatigue, feverish, arthritis, emotional lability, hematologic disorders, and neurologic disorders. The most important thing هو Raynaud's phenomenon, in which the fingers appear blue or red and with swelling نتيجة spasm بالفيزلز راح يصير. طبعا راح يصير بالأطراف أكثر شيء. Now the most important thing that we concern about is the oral manifestation of lupus erythematosus. The oral manifestation of discoid lupus erythematosus as referred as oral discoid lesions, and they occur in about 20% of patients. This may occur without involvement of skin lesions or before the skin lesions develop. يعني ممكن انه تحدث وحدها بدون skin lesion او انه تحدث قبل لا انه يصير السكين lesion. Oral discoid lesions most commonly occur on the labial mucosa, vermilion border, and the buccal mucosa. These are the most common places that DLE occur in it. Typical cases of oral discoid lesions are characterized clinically by the presence of white papules, central erythema, and a border zone of irradiating white stray. يعني نفس هاي الليجن هنا موضحين أكثر، هو إنه راح يصير central erythema and irradiating zone of white stray in the border. هنا مبين يصير بالبلت صاير. طبعا هذا الشيء كلش يميز oral manifestation of lupus erythematosus، كأنما يصير honeycomb plaques, raised keratotic plaques with erythema, purpura and petechia، يعني كأنما قطع حمراء. petechia irregularly shaped ulcers and cheilitis. Oral manifestation of systemic lupus erythematosus frequently encountered and may include oral ulceration. The most common honeycomb plaque, raised keratotic plaque, non-specific erythema, purpura and petechia and cheilitis. ال SLE manifestation almost is يعني identical to that of DLE. But the most important thing is the xerostomia and hyposalivation. Not all patients complain from this, but the most has this symptom, and as we know, this symptom may increase the risk of dental caries because the patient will not have the defense system that exists in the saliva because the hyposalivation. So there's an increase in infections and caries due to this reason. Recurrent non-infectious pharyngitis and oral ulcerations also. Oral candidiasis and infections are also common due to the usage of corticosteroid. As we know, corticosteroid, which is the type of medications that is used for this type of disease, the autoimmune disease. So corticosteroid can affect on the immunity of the body. So as we know, most patients that take this type of drugs can complain of many infections, are liable to develop oral candidiasis and infections as compared with the normal persons who are not taking this type of drugs. Now, this figure shows the oral ulcers, which is painless and maybe nasopharyngeal, يعني more near the soft palates. This is differential diagnosis of oral lesions of lupus erythematosus. As we saw the figures together, we from the figure we cannot exclude the spot diagnosis just from looking at the mouth of the patient, because these figures can make us more suspicious about leukoplakia, lichen planus, mucous membrane pemphigoid erythroplakia, and squamous cell carcinoma. But the thing that can make us to exclude that this is not lichen planus, because lichen planus is symmetrical in type, but oral lesion of LE mostly not symmetrical, asymmetric. Mucous membrane pemphigoid, leukoplakia also. So the diagnosis must be confirmed by the presence of skin lesions. We must look at the skin lesions, and also the spot diagnosis we can achieve from the histologic examination and direct immunofluorescence testing. This will lead us to the spot diagnosis of this lesion. Uh, Now we reach to the end of this lecture. I hope you enjoy these informations, and thank you.